Hello everyone, welcome to AY Tutorials. This is the part 1 of the capsules. Here is the definition of capsules. Capsule is defined as a solid unit dosage form of medicament in which the drug or the drugs are enclosed in a practically tasteless, hard, soft or soluble container of a shell made up of a gelatin. So this capsule, it is the solid dosage form, unit dosage form, and here the one shell is there which is made up of a gelatin and in that we are going to incorporate the drug or the mixture of drugs, and these capsules are hard, tasteless or sometimes soft also. Hard capsules are having rigid shell in two separate pieces fitted together, hence they are called as two-piece capsules. This hard capsule is known as two-piece capsules also. Here is the difference between hard gelatin capsule and soft gelatin capsule. Hard gelatin capsules, they are cylindrical in shape, and whereas soft gelatin capsules, they are having the variety of shapes. Hard gelatin capsule is made up of two pieces, body and the cap, as we have seen it before, and soft gelatin capsules, they are the single piece capsules. Hard gelatin capsule is having specific sizes, whereas there is no specific size for soft gelatin capsule. Hard gelatin capsule is made up of a hard gelatin, whereas soft gelatin capsule, it is made up of a soft gelatin. In case of hard gelatin capsule, the capsule shell manufacturing and filling are different operations. And in case of soft gelatin capsules, the shell manufacturing and filling is done simultaneously. Here are some advantages of the capsules. Capsules, they are tasteless, unit dosage form and readily identifiable dosage form. These capsules are elegant and attractive in appearance, and they are having unpleasant odor and taste. With the capsules, the physicians can manipulate the dose for individual patients, and these capsules can be easily swallowed and they are also quickly dissolved in the stomach. These shells are little or they are having absolutely not interaction with the gastrointestinal contents. It offers least incompatibility issues with the other pharmaceutical products, means they are absolutely compatible with the other products also. These capsules can be easily opened, allowing the contents to be mixed with the water for administration by the patient without any difficulty in the swallowing. Here are some disadvantages also. Let's see. Capsules are more expensive than the tablets. They are hygroscopic. Drugs can absorb the moisture from the capsule, making it more brittle. If the drug is hygroscopic, then it can absorb the moisture, and so that capsule shell can becomes the even more brittle. They are not airtight, thus the shelf life is shorter. Capsules are having shorter shelf life. They are not suitable for the concentrated solutions which require the dilution prior to encapsulation. Then capsule filling volumes are limited, thus the limits the dose of the drug. Filling operation is performed without the compression and thus it occupies the more volume. What kind of materials can be filled in the capsule? Let's see. The material types which can be filled into the hard gelatin capsules are dry solids, semi-solids and liquids. Dry solids, there are some examples like powders, pellets, granules or tablets, and in case of semi-solids it is suspension or paste. Then in case of liquids it is non-aqueous liquids. Sizes of the capsules: 000 is the larger size and 5 is the smaller size. There are total 7 sizes of the capsules. In that 5 is the smallest one and 000 is the largest one. Preparation of the capsules: the large scale or small scale preparation of filled gelatin capsules is divided into the following general steps. Here are the some steps of the preparation of capsules. First one is the formulation, development and selection of the capsule size. This is very important step, the selection of capsule size. Then second one is the production of hard gelatin capsule shells. First of all, we will select the capsule size, then we'll go for the production of hard gelatin capsule shell. Then after preparation of that gelatin capsule shell, we will fill the drug medicament into that. Then sealing is done, and after the sealing, cleaning and polishing of that filled capsules is done, and after that finishing. So these are the 6 steps for the preparation of capsules. Here is the formulation development of the capsule. First one is the plasticizers. The wall of the hard gelatin capsules, they are firm and rigid, while those of soft gelatin capsules, they are more soft and flexible. As we know that hard gelatin capsule is having rigid body and soft gelatin capsule is having the flexible body. The soft gelatin capsules, they are soft because it contains the large proportion of plasticizer, and hard gelatin capsules, they are not having the plasticizers in that amount. The most frequently used plasticizer is glycerol, and other plasticizers being used are sorbitol, propylene glycol, sucrose and acacia. But the more frequently used plasticizer is glycerol. Formulation development in that colorants. Colorants which are used, these are of two types, soluble dyes and insoluble dyes. The soluble dyes, they are mainly synthetic in nature, and using the mixture of dyes, capsules can be made in all the colorant of the spectrum. The pigments which are used for this, they are of two types. One which is used in the largest quantity is titanium dioxide, and this is white in color and it is used as a opacifying agent. The other class of pigments is the oxides of iron, which are in black, red and yellow in color. Then third one is the preservatives. These are sometimes added as an in-process aid to prevent microbiological contamination during the manufacturing. These preservatives are very important to avoid the microbiological contamination. Manufacturers, they usually operate their plants according to the good manufacturing practices guidelines to minimize this risk. And in case of finished products, the moisture levels are such that bacterial growth is not supported. If moisture level is less, then as we all know that bacterial growth is not possible over there. Soft gelatin capsules, sometimes they have the antifungal agents to prevent the growth on their surfaces when stored in non-protective packages. Propyl parabens and methyl parabens are there. They are mostly used preservatives in the capsule manufacturing. I have highlighted these two things, that propyl paraben and methyl parabens, they are used as a preservatives over here in the capsule. Then diluents are also used. These are needed in certain cases only where the medicament quantity is too small. When there is the small medicament quantity, at that time only we are going to use these diluents. In such a cases, diluent is added to attain the desired bulk of the medicament. This is the function of diluents, that they are added to increase the bulk of that specific medicament. Then there are certain examples of the diluents which are lactose, mannitol, sorbitol and starch. The quantities of the diluent to be incorporated, it is depending on the medicament dose and the capsule size. Then absorbents are also there. Sometimes the medicaments, they are physically incompatible with each other. For example, eutectic substances or hygroscopic substances. In such a cases, the absorbents such as oxides and carbonates of magnesium and calcium and kaolin, they are added to the powdered drug. Absorbents here used are oxides and carbonates of magnesium and calcium and kaolin. Okay. They are the inert materials and which are act as a protective also. Then glidants are there to ensure the regular flow of the powder into the automatic capsule machine, and glidants are mixed with the medicaments. Some glidants are there like talc, magnesium stearate and calcium stearate like this, and they are mixed with the our drug to improve the flow of the powder. Then anti-dusting compounds are there. During the process of capsules filling, using an automatic filling machine, the dust is generated in huge amount which is inhaled by the operator. And in this case, it causes a serious health hazard if allowed to be unchecked, especially when the dust of the potent drug is inhaled. And to avoid this, some anti-dusting compounds are there like inert edible oils. They are added to the formulation. Dust formation is there while the filling of the capsules, and to avoid this problem, some anti-dusting compounds are there like edible oils. It is mixed with the medicament and it is act as a anti-dusting agent. Then opacifiers. The most commonly used opacifier is titanium dioxide, which may be added to produce the opaque shell when the filling of the formulation is the suspension. It may also be added to prevent the photo degradation of the light sensitive fill ingredients. The concentration of the opacifiers may be up to 0.5%. These opacifiers are there to prevent the photo degradation of the light sensitive material, and examples of these opacifiers are titanium dioxide, which may be used in the 0.5%. Formulation of gelatin capsule shell. Here are 8 steps of the formulation of gelatin capsule. These steps are very important: dipping, spinning, drying, stripping, cutting, joining, polishing and printing if necessary. The names of these processes is very important. Formulation of gelatin capsule. It is the major component of the capsule, and gelatin is the heterogeneous product derived by the irreversible hydrolytic extraction of the treated animal collagen. This is the definition of gelatin. Gelatin is basically the heterogeneous product which is prepared from the animal collagen. There are two types of the gelatin, type A and type B. Type A is sourced from the pore skin, whereas in case of type B it is sourced from the bone. Then processing, in case of type 1 it is acid processed, and in case of type B it is base processed. Isoelectric point of the type A capsule is 9, and in case of type B it is 4.7. This is the actual manufacturing process of the gelatin. First step is the extraction of gelatin. Gelatin is the heterogeneous product. It is derived by the irreversible hydrolytic extraction of the treated animal collagen, and source of collagen is animal bones and skin. There are two types of gelatin, type A and B. A is derived from the acid treated precursor and exhibits an isoelectric point of the in the region of 7 to 9 pH. And in case of type B gelatin, it is derived from alkali treated precursor and which exhibits an isoelectric point in the region of pH 4.7 to 5. These capsules, they can be made from either type, and generally a mixture of both types is taken. This slide is very important in case of exam point of view. Here are the methods of capsule filling. Capsule filling involves these several steps. First one is the feeding. These empty shells of the gelatin capsules are fed into the hopper, and its direction is adjusted automatically, such as body position towards. Then the separation. Body and cap is separated by means of vacuum suction, and then after separation the filling is done. Determined quantity of the dose is filled in that body. Then locking or recombing. After the filling of the medicament, cap is again placed on the body and then it get locked. Then ejection. Finished capsules are then ejected by means of the punch. So these 5 methods: feeding, separation, filling, locking and ejection. These are done in case of capsule filling. Here we are done with the part 1 of the capsules. If you like this video, please like, share and subscribe to the AY tutorials. Type 2 of the capsule, I will upload it tomorrow only. Thank you.